This is Insight, a public affairs presentation of 88.9, The Alternation. I'm Bob Long, and for the next 15 minutes, I'm going to be talking with Amie Cajka, the Director of Community Relations for the Mental Health and Recovery Board of Portage County. We're going to be discussing issue number 3, which is coming up on the November 5th election ballot. And as Amie is quick to point out, this is a renewal, and it is not a new tax.
That's really been our main piece of information that we say to people first, is that it's a renewal. And the fact that it's a renewal means that people have voted on it before. They've passed it. They're paying the same. It stays the same. It stays the same at $1 million for this mental health and recovery renewal levy. Funds mental health and recovery services for Portage County residents. And basically, right now on a $100,000 house, you're paying $250 a month. That's $2.50 per month for this particular levy. So it stays the same, and that's what's really important about it, because I think people are still saying, okay, we're gonna okay the levies that we have. That's good basis for local services, and they'll approve that, which we appreciate.
I don't know that people really totally understand exactly what it is that the Mental Health and Recovery Board does.
Right. I'll put it in context of these levies. The levy helps us fund basic mental health treatment, addiction treatment services for Portage County residents. And that's something that you can equate to, say, a parent is having a serious mental health problem with a child, and the child goes to, say, Children's Advantage in Ravenna and needs an assessment. Possibly needs to see a psychiatrist for medication, needs to see a therapist once a week, twice a week, once a month. The mental health problem could be so bad that it becomes a serious mental illness problem, like early onset schizophrenia or bipolar disease for a young child. At that point, a lot of families, it's an overwhelming process. How do you work with the school? How do you work with the service provider, the counselor? What if the child needs some 24-hour kinds of oversight or care? At that point, at Children's Advantage and through the funding of this levy, we can provide case management services for a family, which means that there's somebody helping that family navigate through services and issues with school and issues with medication. So it can be fairly daunting for the family, but there is that support there, and because of the levies, Portage County has that support. Now that translates the same into services for an adult. It translates somewhat the same for addiction type services. We don't have detoxification services here in Portage County, but there are points in time when somebody who comes to our services through Town Hall 2, the levy will help fund some 3-day, 4-day type detoxification services through St. Thomas in Summit County. So what you have is the ability for some people who might be ready to make that change in their lives to get on the road to recovery for addiction. The levy funds help us pay for addiction services. Person comes back into the county. Now there are halfway houses, residential treatment centers for both men and women. You have Horizon House for the women and the new Root House for men. And basically a person can go there, stay for a period of time, graduate from the services, and hopefully at that point they've rearranged their life and their relationships so that they're not using anymore. I think what's really troubling to a lot of us in the recovery community, especially working from the standpoint of services, is that Portage County is seeing quite an increase in the number of heroin-related deaths and heroin with other drugs. Last year, 15 total, which was an all-time high for Portage County. Now we've already hit that number 14 this past month, and of course there's 2 months left. So what we know is happening is that people are getting a hold of the drugs. They're usually a little bit stronger than maybe they're used to, or they're coming out of detox services or whatever. They're going back to the drugs, back to the same old life, and it's an overdose that apparently is fatal for them and devastating for families. So there's those real key basic services that levies fund.
You also have crisis intervention also, right? A number you can call. And
Right. Counseling's one thing, treatment services are another, but the Mental Health and Recovery Board is the one agency in Portage County that supports a 24-hour crisis telephone system. You've got Town Hall 2. A lot of people who've lived in the county probably know about the helpline. It's 330-678-HELP, or that's 678-4357. Or there's also a 24-hour line at Coleman. Now, the Coleman line is used a lot by Coleman clients or people with serious mental illness. It connects them up with their services, referrals, information. The Town Hall line is our suicide prevention line. It also connects people up with referrals, services, questions. It's 24 hours. They handle 41,000 contacts between the two lines in a year. It seems inconceivable that there would be that many questions or calls, but there are. A lot of them are for, of course, the crisis issues, the suicide prevention issues, a lot of them for information and referrals. So the Mental Health and Recovery Board, through our levies, funds those, keeps those viable, going 24 hours a day for Portage County residents.
you work with the schools as well, correct?
Yes, the board funds a program that is in every school district, and what we have going is that through Children's Advantage, again, the child family mental health agency that we support through levy funds in Ravenna, there is a staff person that goes out to those school districts.
Is that like every school in the county, or
Every
most-
district in the county.
no matter where
every-
you are in the county, Portage County,
Right.
this levy is affecting you.
Right, exactly.
schools, yeah.
Exactly, from Aurora to Southeast to Wyndham to Field, and all the districts in between. And what happens there is that there's a person with a lot of background in dealing with children and families who's there on the campuses for staff. They interact with the classroom teachers, they interact with administrative staff, or they interact with the guidance counselors. And those folks in the district know which families are having problems, which kids are having problems, and which families need extra support. So our staff person from Children's Advantage is able to connect with that teacher. They connect with the family. They're able to get that family to services right there, even stay in the district. And that, sometimes that's really where things break down is that the family, families have a lot of schedules these days. Parents are working. If they're not working one job each, they're working 2 jobs or more.
Yeah.
So basically you've got a lot going on in the family. So the service can be hooked up right there at the school, in the school building, actually. Last year they assessed and talked to families of 660 some children. About half of those kids got further referrals into more deeper services. So there's something going on there that's successful with that service and hooking up families, and they've got some good stories about kids who are in that place where they may be dealing with bullying issues or self-destructive issues like cutting or thinking or talking about suicide issues. And in one case, a family used and accessed the service to help a daughter who is in the teen years, and the family really wanted her to have Christian counseling, and that was fine. Basically, they used local county service to get the assessment done, to get her hooked up, and then she went on to have counseling services where the family wanted her to be counseled. But basically, the family came back and told the school and Children's Advantage that the management of this child's services helped save her life.
So this is all part of what Issue 3 does.
This is all part of what Issue 3 does on a daily basis. We're out in the community going to schools, talking to people on the phones, seeing people for counseling. We've been working with police and law enforcement, and also through schools with crisis intervention team training. And we just had the 2013 Officer of the Year awards. They went to somebody at Robinson Memorial Hospital, Lieutenant Sharon Hissam, and someone at Kent State University, Officer Will Scritchfield. Streetsboro has an Officer of the Year in Sergeant Andy Suvada, who maybe a lot of people know just from his work in the community. So it's just another way that our board reaches out to the community to help the resident or the citizen who might be having a mental health issue and in crisis, and at the same time becoming involved with the police department. It keeps the officer safe because the officer understands more about mental illness, understands more about what that person is thinking or what they're not thinking about, what their reality is, what they're able to understand. And it keeps the officer safe, it keeps the person safe, and it greatly increases the possibility that that person will get referred into services, and we can stop the cycle that usually happens. Mm-hmm. So there's a lot that we're doing. The other aspect that we have is that our counselors and social workers who are in all of our agencies, Children's Advantage we've talked about, Town Hall we've talked about, Coleman Professional Services we've talked about, and Family and Community Services. All of those agencies have people who volunteer with us for an incident response team. And it's a team that will go out into the school districts, into businesses, or the community at large when there is a death. It can be a death that may have been an accident, or it could have been a student completing a suicide. It could be an accident at an local industry, or it could be a community incident like a natural disaster, like say it's a tornado or earthquake or whatever. We've got a team that's ready to go out to be deployed with the Emergency Management Agency in Portage County to be there on site and to be talking with people and giving them support and education, and to be the backup for first responders when they also have issues with these kinds of things.
So this is a renewal, issue number 3, and I presume if it doesn't pass, they're going to have to be reducing some of this. Is that probably a safe guess? Yeah.
Well, I know that we'll probably come back and try to renew next year. We'll come back again for another campaign. If we fail to do that, this is the levy that provides now more than 50% of our income. Mm-hmm. So you can imagine what that means. I mean,
all these services we've been talking about for the last 10 minutes, yeah.
Right. We'd be basically triaging back to basic services for the people that have the most devastating problems, either addiction or mental illness. And right now, we've been functioning with less state funds. The state, since 2008, when there was such a downturn in Ohio, and they basically were cutting back at the state budget, Portage County was getting probably $2, $3, $4 million a year. Now we're getting half that much. So between the state money and what we're getting now, we're down $2 million. And we've been trying to keep up with the funding by using reserve money, and that's being used up bit by bit. It functions pretty much like a school district and the way school districts work. But pretty soon that money's going to be gone too. And I know last year we served about 10% less people because of the downturn in the state funding. So that would continue, yes.
Okay, so this is critical. Issue number 3, when you go to the polls in November, or ahead of time. Voting is underway right now, absentee balloting. So now, between now and November 5th, we're talking about renewing issue number 3.
Yes, we will be happy to send anybody any kind of information. And actually, we're on Facebook at MHR Levy. We're also on the web at www.mhrlevy.org. And if you want to become one of our tweet buddies, well, you can find us at MHR Levy.
Join the Twitterverse.
Yes, Twitter has gone to the campaigns, and it's a whole new world out there for campaigns.
Thank you, Amie.
Thank you, Bob. Glad to be here. Thanks for having us back.
We've been talking with Amie Cajka, the Director of Community Relations for the Mental Health and Recovery Board of Portage County, about issue number 3 coming up on the November 5th election ballot. That's Insight for today. I'm Bob Long. Good day.